COVID-19 has changed millions of lives in India, where more than 4 lakh people died. Each death is not just a number, but a world for their respective loved ones. It's a harsh truth that 1,700 children have been orphaned since the beginning of pandemic in India. As per the report of India's Child Right Commission, 577 children lost their parents between April 1st and May 25. Many non-governmental organizations in India is tracing the children who lost their parents in pandemic. In Delhi, NGO like Prayas, Institute of Juvenile Justice are working day and night for helping the orphaned children whose parents are no more in this world.
If I present you my COVID-19 response report, so nearly more than 6 lakh meals we have, 6.3 lakh meals we provided to the migrant workers and construction workers affected by COVID, those who are covering. Then coming to the children, in fact, more than 80,000 children and the families to whom we have supported with the family rations only. Yeah. And not only to those children who are living in our homes and shelters, rather than we also went to slums. We went into deeper communities to come to know what are their harsh realities, what are they facing. So we provided more than 80,000 family ration kits on a consistent basis for 4 continuous months. We are coming closer to those children who are orphaned by the COVID. Either we are collecting the information and either they have lost one parent or both the parents. What are we doing? That we are trying to provide them support, first initial support to them, and then we are bringing these facts, these numbers before the bench of the Child Welfare Committee, before the DCPCR, Delhi Commission for Protection of Child Rights, and DCW also, Delhi, that is Department of Women and Child Development, DWCD. Now, the whole purpose of identifying these children so that we can connect them with the schemes, with the welfare schemes of the Delhi government as well as of the central government. So that is our prime work as of now. And every day we are collecting information, every day we are trying to reach out to these families. That is one thing which we are doing. And I am also sharing with you that the COVID-19, in fact, it has also affected my colleagues also. I lost one of my colleagues who was working with me, who was looking after the children's project. He was only 37 and he came to us when he was only 5 years old. So he died because of COVID. His name is Arjun. It is another concern which is coming, in fact, and which is hitting all of us who are working in this particular sector of child rights. That child protection has become the major concern now. Yeah, and we need to ensure that the children affected by the COVID should not get entrapped by the traffickers. Yeah, they should not be come under the clutches of the traffickers. And even the instances of child labor is also increasing because children are easy target and they can be engaged in exploitative work by paying a minimal amount of money, and it's all depend on the employers, in fact. Yeah, so every day the operations which we are conducting, we have increased our operation. Secondly, parents are parents, and the children are children, irrespective of the status, that whether they come from rich family or upper middle class family or the poor family. What we realized that if you lose your parents at any stage of your life, you will be affected. Yeah, it has nothing to do with the age. Now the fact is that definitely when they are very young, yeah, when they are not in a position to take care of themselves, when we run certain responsibilities towards them, either providing quality educations or nutrition or shelters, so that we can help them in growing up in a holistic environment. So that is one thing which we are coming across. We also have some cases which are coming from very well-to-do families, and their extended relatives, either based in different cities or in other countries, they have shown keen interest for adoption of these children. So we are helping these family members in order to understand the counseling process, in order to understand that what are the procedure of adoption, what are the formalities they have to comply with. So these are the things which we are additionally doing it.
As per the survey done by Delhi Commission for Protection of Child Right, at least 2,000 kids has lost either one or both parents due to COVID-19. 651 child lost their mother and 1311 lost their father. There are 67 children like Devika who lost both their parents in last 1 year due to pandemic. Second wave of COVID-19 has totally exposed the condition of health in India. Whole world has seen how COVID patients have died due to lack of oxygen. Although on 6th of July, Minister of Health and Family Affairs Dr. Harshvardhan resigned from his post. But the question is, will financial compensation and resignation fill the unbearable pain through which more than 5,500 children are going through? This is Piyush Kumar for the headline.